Nurse midwives are a version of advanced practice nurses. So it's somebody who's gone to school, become a registered nurse, and then they've gone on further to get their master's degree, and some even go on to receive their doctorate, so that they can take care of women through all ages of life, from the time that they start their menstruation all the way through until through menopause and the end of life. And then they play a key role during labor and delivery and pregnancy. The nurse midwives play a large role here at Riverside on labor and delivery. So we see most of the patients when they come in through triage. We also play a large role during their labor and delivery process. And then we also take care of women when they're actually delivering, as well as we're the main ones that do the rounding on postpartum. What makes the program here at Riverside unique is that we work together in a collaborative model. So whereas some other practices, the midwife program is separate from the physicians, so when complications or high-risk things develop, those women are going to get transferred on to the physician providers. Here we continuously work together. So even when high-risk complications may come up, we work together so that the midwives can still be involved in that management and care of those patients, and that way the patients never have that transfer over of care, so they still have that continuity with the same team members they started with. So midwives can be in many different positions. Some of them are going to work strictly in the office, and so in the office they're going to see women for when they want to get started on birth control. They're going to see them for annual well woman visits. They can see them for GYN complications, as well as simple GYN procedures that may need to be done. Other midwives may be solely focused in the hospital, in which case their focus is going to be more of that labor and delivery, childbirth, focus more just on the hospital side of things. And then, like what we do here, we kind of fluctuate between both of those things. So it's important to know that midwives can support any type of childbirth. So if you want to come in and you want to have an unmedicated birth, and you want those low interventions, we can support that. If you are wanting to have IV pain medications, or your plan is to get an epidural as soon as you come, that's fine. We can support that too. So we can support childbirth in all sorts of formats versus that traditional thought of midwives only take care of those people wanting to deliver at home or without pain medication.